Welcome back to this week's edition of Freedom and Prosperity Radio, the weekly radio's news magazine that we put together here at the Virginia Institute for Public Policy. Find us online at virginiainstitute.org, and you can find archived footage, as I like to call it, of previous programs. No, you can't see what I look like, but you can hear all about it on our YouTube channel. Just search Freedom and Prosperity. Real story from just earlier this week. Several central Virginia communities were bemoaning the fact that medicinal marijuana is hard to come by because the clinics at which you would get your prescriptions had to close because of COVID-19, ironically driving up the interest in medicinal marijuana for depression and things like that. But they said there was a fix. There was Tele-Health, and the one remaining clinic was available for Tele-Health out of Richmond, and they were all so in favor of Tele-Health. All of a sudden, it was as if they had just discovered it. Somebody who knows everything there is to know about Tele-Health and has actually put together a policy primer for all of us so that we know a little bit more about what's going on there is Caleb Taylor with the Tertium Quids, and he's with us here now on the program. Caleb, welcome back to the program. How are you doing, sir?
Thank you. I'm doing wonderful. Thanks for having me back.
So there's the obvious reason that, everyone should have a basis to jump off and have a conversation with somebody about something that we hear a lot about, telehealth, but I don't think a lot of people know about it. Is that what was behind writing this policy primer?
Well, what we really focused on in this policy primer and what we focused on, we've been working on telehealth now for, I think, 3 or 4 years, very successfully. What our real focus was supply. And, the healthcare conversation has been dominated by how are we going to pay for this? How are we going to pay for this? How are we going to pay for this? Who should be the payer? Should it be the state? So the single payer guys say that. Should it be purely cash pay? The more libertarians say that. We have this third party insurance system that's been around since the 1940s or 50s that seems to have been designed broken. But, it's really, really easy to dig yourself in a hole in that conversation. So we started looking at other avenues, ways that we can correct certain issues in the healthcare market. And I put big quotations around market. And one of these is we need to focus on supply. How do we get more supply? Mm-hmm. One of the ways that we do this is allowing innovations to thrive in the market. Telehealth being one of them. There's other things as well, but there are a lot of regulations and there are a lot of laws and programs that the state, Virginia specifically, the state keeps that market from developing, keeps that market for medical innovations from developing. And so we've just been working on that for the last several years. And we've started putting out a lot of information on this because there's going to be some more big pushes and really big carries, like trying to finally get rid of COPN. And we want people to be aware and be ready. Be ready to be in contact with your senators and delegates and the governor to make sure he knows. Everybody should know that this needs to move forward. We need greater supply.
Is there... And we saw this a little bit as even other topics like border security, immigration reform get tripped up by groups like the U.S. Chamber of Commerce. And you say, well, why would they be against it? Well, because their employers, their members benefit from it. Do groups like the AMA get in the way of this kind of supply increase because in their short-sighted view, my insertion there, that it benefits their membership to restrict other people playing in the same sandbox?
Well, we haven't seen as much movement from national organizations as we have from state organizations. Some of the biggest detractors on this were like the Hospital Association, which you and I have talked about at length, the Hospital Association being the second largest political donor in the state. They really understand that it's not doctors that individual doctors, every doctor that we've talked to has been absolutely excited about the idea of being able to utilize telehealth as a really innovative triage for their patients.
Mm-hmm.
It's almost like going back to a time of home visits, but without the doctor ever having to leave his office.
Mm-hmm.
And it does. It works we've seen this in a lot of different industries, including the VA. The VA instituted telehealth years ago and saved millions, not just for them as an institution, but for their patients who had to do so much less driving.
Yeah.
And traveling to get to their hospitals. But yeah, so we run into issues with associations, but we don't run into issues with the membership of those associations. Yeah. Between the hospital association and in the past the MSV, although of late the MSV has come on board, I guess seeing the writing on the wall with this. We've seen kind of this. We have a conversation with their individual membership, and their individual membership is all on board. We have a conversation with the institution itself, and absolutely not. Mm-hmm. But the times be a changing. We have seen a lot more support from corners of the healthcare apparatus that we did not see in years past, and I think a lot of them are recognizing that this is not something that's going to damage anybody in the market. It's something that's going to be immensely helpful to making emergency rooms operate better, private practitioners operate better. This just dramatically increases their ability to be present to their patients.
It's almost a reaction, the way physics works, that, during the Obamacare ramp up, one of the arguments, and I would push back against it, saying it was self-inflicted, was the loss of the community doctor. The old country doctor was gone, and everyone had to go to these medical clinic practices, multi-doctor. And I said, you're doing this because of insurance. The doctors are not being driven out of their hometowns because they don't want to treat their patients there. And maybe this is a marketplace reaction saying, okay, well, if the offices all have to kind of pool together resources, at least this way the doctors can get out from under that restrictive locale.
Yeah, I've been really, really surprised over the last several years at the number of times that doctors have been blamed.
Sure.
And it's just been ridiculous. I mean, the number of times, the market has changed because doctors are greedy. What?
Yeah. Well,
the market has changed because doctors are now, they're going to work for hospitals because hospitals pay them more, and they don't, and they have to do less work, or something along those lines. It's absolutely ridiculous.
Well, I made the point, the new health care out of Washington is broadband. And, that's and I feel bad for healthcare because healthcare used to be the football they all played with until they discovered broadband, because the broadband providers are all on board, whereas doctors pushed back against the Affordable Care Act in such great numbers it became a harder sell.
Yeah, and it may be that the broadband companies realized that, once we get into this mess, we're going to be the answer to get out of it.
Yeah.
I don't know if they realize that or not, but yeah, I mean, it's
But it's connected. It is connected to this because even proponents of telehealth say, well, telemedicine, it really requires everyone to have high-speed government delivered broadband. When I watch, Doctors Without Borders using what does Elon Musk call it, Sky-Fi, and his new satellite operations to bring medical care into parts of Africa at speeds that make, Western Africa's got better Wi-Fi than Western Albemarle.
Well, that's actually a really interesting point because this is something that we had been waiting on for a couple of years as well. So one of the reasons, I've always kind of hated broadband's position on this, even though it was supportive. Mm-hmm. The companies, they were really looking for a way to, and you could see it just in their arguments, they were really looking for a way to kind of establish these monopolies, these artificial monopolies, like AT&T did back in the day.
Right.
And the amazing thing is that right on the cusp of them accomplishing this, I believe it was the FCC came through and changed the OTARD rules so that now anybody in the rural part of Virginia can set up their own satellite or Wi-Fi tower at their house.
Yep.
And is now protected just like a satellite dish would be. And the local government cannot make them get rid of it. So, we're going to see, I think in the next several years, especially as these things become more lucrative and valuable, we're going to see those privately funded towers pop up all over the place. And suddenly broadband is going to be out. I mean, why do we need broadband if we have higher speed, Wi-Fi internet coming in from the tree outside?
Well, and we made all the TV stations move to create more spectrum space anyway when they went into the HD world. But, of course, watch out for this one, kids. This speaking from our flagship area of Central Virginia. Watch for the phrase viewshed, because what will happen is these Dudley Do-Rights will then say, but if I can see it from the road, it impacts our viewshed. And we want to, and it's a sort of the colonial Williamsburg model that says, everything should look like it did in 1776, and then the people will be happy with that. Caleb Taylor is on with us. Caleb Taylor of the Tertium Quids, and I hazard to say author, but certainly the moving force behind our telehealth movement, but also this policy primer that you can get. Where do people, can they order it? Just go online to virginiainstitute.org and get it? How can people get a hold of this for themselves?
Absolutely. They can go on the Virginia Institute website, and you can go to our info at virginiainstitute.org. Just request the information packet, and we're happy to send it out. It's just a short primer, gives you a rundown on everything that we've been working on and what we're going to be working on, and how you can support the movement. I mean, we're doing everything we can to kind of undercut the continuously increased costs of healthcare in the state. And we've been immensely successful so far, and we're just going to keep on pushing.
Caleb, let me ask you, the 800-pound gorilla in the room is the third combo of the Third and Fourth Amendment, and then throw HIPAA on top of it. Heck, you can even use the premise that Roe v. Wade was argued for, and it's the privacy of your interactions with your doctor. How does what we're hoping to develop more of, telehealth, address the issue of privacy and somebody interloping on my question with a doctor about some rash that's in some area that might be embarrassing to my employers?
Well, this is something that we've been working on as well, is how exactly do you handle liability in this concern? I think that in the past, the regulatory bodies have handled it really poorly, and that's why it's been an issue in the past. But we started moving towards a more I almost used the word secular.
Well,
a more decentralized model in handling this, whereas we essentially make the providers legally responsible for it. And it makes it very, very easy for if something were to happen. If something were to happen, it makes it a lot easier to go after the providers who caused the issue or allowed the issue to occur. But it also provides a direct incentive to telehealth providers to be the Fort Knoxes of privacy on the internet. We never know what new thing is going to be developed until we allow it to be developed.
Yeah.
But this is one of those things where we are working really, really hard to make sure that the market is prepared for the influx of people wanting to get into this very easy very simple technology that's easy to use, that they can immediately get on with their doctor or a doctor connected into their private practice. Have a quick question, get off the phone. Super easy. That's how it should be. I mean, and if healthcare had developed as since the 50s as an actual market, I guarantee that this would be something that we could normally do.
Yeah.
And we should be able to.
Well, let me follow this, to its conclusion then, because it goes back down to control. It goes back down to who's paying. How do I know what you're charging? I know doctors who had what I used to call the desk drawer rate. If you went in and said, "Doc, I just want to pay cash," and if they knew you and knew that you weren't going to narc them out to the health insurance provider that would delist them, they would see you for $25-$50. Depending on what it was you needed. You talk about liability, you talk about abilities of a doctor to triage over this, but I mean, COVID-19 has created smartphone apps that can do a lot of the diagnostic, machinery now as well.
Mm-hmm.
Is that a combination that is going to, render telehealth impossible to stop from a hospital or a government's standpoint?
I mean, fundamentally, yes. These new advancements and the fact that the up and coming generation is very, very health conscious. The telehealth is an inevitability. What we want to make sure that we do is that as it builds, the regulatory bodies are not creating more and more of these geographical monopolies in these areas. So, this is where occupational licensing comes tied into this issue. It's where regulatory reform comes tied into this issue. We want to make sure that they're not creating, the only three companies that are allowed to create and sell insulin, that issue, right? We don't want only three companies that are allowed to provide telehealth. No. We want thousands of companies. Because whereas, some people are looking for that desk drawer, payment model, I'm looking for the grocery store payment model. Yeah. Where there's so many different kinds of telehealth that the prices cannot rise.
Absolutely. And I think this is going to define the next few years. What about the political landscape? We have a few minutes left here. Caleb Taylor of Tertium Quids. Politicians,
as far as the political landscape for this, it's actually rather interesting because it cuts across the ideological spectrum in a very weird way. So the Democrats who tend to be on the left, the younger Democrats, and the more libertarian conservatives are on the same team here. Mm-hmm. Whereas the kind of please don't change anything Republicans and Democrats that would just prefer to have really clear control over everything, they're the ones that are kind of the calcified middle in this regard. But that's changing. I mean, Democrats are coming around very, very quickly to this effort. Republicans a little slower, but we're getting them as we go. Mm-hmm. And I've actually, it's been a really surprising. Like, this was kind of one of those things where we started and we expected to work with the same old guys, and we ended up building relationships with wholly different people working on this. So it was very interesting.
Well, and ironically, anyone who's read the Russell Kirk books, and for those who have never heard the name, it's where Buckley and then Limbaugh and all the other ones got it from, and it's mm-hmm. where it kind of begins the idea of conservative thought. And one of his principles of conservatism is that, like a gardener, you can't keep your garden static. Conservative doesn't mean never change. It means you want to make sure you're bringing about change that's beneficial for all.
Yeah, and that's what we're working on. And really, I mean, I'll tell you, the biggest fight on this one, and this is something you and I have talked about before, I believe, the biggest fight on this one is that the healthcare law is written from a very backwards, like rhetorically speaking, a very backwards direction. It is written from the point of view everything is illegal until the state says it's legal.
Right. Well, that's Virginia. That's sadly, as the state that gave us the Declaration of Independence and the U.S. Constitution / Bill of Rights, people would be stunned to find out all the things that you have to get permission from the government to do before you can ever do it, like selling the produce you grow on your farm at your farm.
Yeah. It's a pretty ridiculous kind of legal point of view, and this is the thing that we're having to fight most against. But like I say, we've been very successful so far. We will continue pushing, and anybody that's interested in getting this information, info at virginiainstitute.org, and we'll happily send it to you.
And it's super long. It's very easy to digest, so that when you're at that Memorial Day barbecue that Governor Northam may or may not give you permission to go to. I'm sorry. Was that out loud? I'm sorry. It's and the ads still haven't, by the way, caught up to the Massachusetts research, because the advertisements that they're running with our taxpayer dollars still say 6 feet. But when you are at those gatherings and people say, healthcare is still an issue and we need to, you have answers. You have things that you're going to be the cool kid at the water cooler with this. Primer from the Virginia Institute. Not to oversell it, Caleb, but I know you are always the cool kid at the water cooler.
No, I was always the nerd.
You and me both. That's why we're the cool kids now, because we all know where the cool kid wound up. Anyway, but bless you for doing this. Are there other policy primers that are going to come, or is this right now we're going to stay laser focused on this until we see some movement?
Actually, we are working on several more. In the last couple of years, the Virginia Institute and Tertium Quids have been able to expand their capacity. We're going to be working on taxation. Of course, taxation is a big deal, and there's going to be a big push from a lot of organizations in the near future. Even with the current mix in the House and the Senate there in Richmond. We're gonna be talking about taxation. We're gonna be talking about occupational licensing. We're gonna be talking about a lot of different issues that are really a big deal today. Independent contractors, how they work, how they're paid, and how they're considered in terms of taxation as well as in terms of employment.
Yeah.
We're gonna be really, really pushing for as much growth and freedom as we can in a lot of different places, and you'll see primers in each one of these start coming out of the Virginia Institute in the next several weeks.
It's why I refer to the Virginia Institute as a do tank. You heard, everyone's got a think tank. We actually have a do tank here in Virginia. And Caleb, thank you so much for sharing this and the soon to come primers as well. And you have an awesome weekend. You
as well. Thank you.
Thank you all for joining us. Again, podcasts of this will go up to our YouTube channel. Search for Freedom and Prosperity Radio. And until next weekend, I'm Joe Thomas. So long, and thanks for all the fish.